You had mentioned earlier that it was kind of disheartening knowing that you were diagnosing a patient, but you couldn't necessarily, you didn't have that ICD-10 code. How does this disease being indexed as a subcategory affect the treatment course of the disease?
So that's a great question. And I think, as another illustration of how our administrative systems sometimes lag behind clinical understanding, there are actually multiple approved therapies for the treatment of non-radiographic AxSpA today. And yet, even though those therapies are in existence and approved by the FDA, until now, there was actually not a code to identify these patients accurately. And so a clear disconnect there that I think it's easy to appreciate. For these patients, I think that there is certainly an empowerment in naming. Again, the experience that they typically have, very sadly, is one of a long and convoluted journey to diagnosis. And so receiving an accurate diagnosis and being able to name that accurately is very empowering to these patients, but it has practical implications for their care as well. And when there are indicated therapies for a disease and yet a prescriber doesn't have the ability to communicate that accurate diagnosis that aligns with that indication to a payer, it can make it very difficult to achieve access to therapy and treatment.